So it is very, it's a privilege to really kind of participate in this, the inaugural meeting of this foundation, the European Sickle Cell Federation. I think it is really long overdue. And I think it's also quite timely because it's something that we think actually should be relevant for all of us to ensure that we address some of the challenges that we are encountering and we actually would encounter, and also to address some of the issues that may be a bit peculiar to our own populations. But we bear in mind the fact that there have been a change in demographics in Europe, particularly not least by the impact of the migration, which were from countries with high prevalence, but for sickle cell disease and for thalassemia. I know that the twin issues are actually very similar, but obviously we can try and address them as we look at them separately. And the migration actually was highlighted in around 2014, 2015, when there were increasing number of people moving into parts of Europe that actually were not very familiar or have been involved in the management of sickle cell disease. And therefore, there was no clear structure or infrastructure to address some of the needs of patients kind of moving in. And I know that I have participated in conferences where people have discussed about, do we screen for sickle cell disease as part of the migration? Because in terms of screening, and would that be discriminatory or would that be kind of supportive? But looking at the increasing numbers, and particularly for sickle cell disease, we can look at countries, populations coming from Nigeria, from a number of African countries. At least in this particular snapshot that we did when we did this paper, we're definitely going to increase the numbers of patients with sickle cell disease. But we know that prior to this, a number of countries have been very familiar and involved in the care and the management of patients with sickle cell disease, particularly in the United Kingdom, France, and this where there were actually patient associations that actually supported these patients. But with increasing migration, and I know Ireland, I also have a kind of very rapid increase in numbers, and then subsequently Germany and others actually began to see numbers, and then we began to see increasing interest to understand what are some of the challenges that patients and people living with sickle cell disease would do, and would there be should there be a uniform European response to this? And the Europe Bloodnet actually, obviously, Stefan Lobitz and the cohort actually, a group actually agreed to call a consensus meeting, which happened in Berlin, and it included a majority of experts, but doctors, scientists, and people that are really stakeholders, and also patients as well. Patient associations were well represented in this group meeting, and that led to this consensus statement. And the consensus statement took into account the fact that services, particularly like data and newborn screening, were not kind of standard in a number of the European countries, and also the issues that people come with, particularly you come into a new country, you're not familiar with the system. How can you actually navigate the systems? And all of this were really kind of recognized. And I know that as a result of that, there have been different subcommittees that the Europe Bloodnet have actually kind of developed to address some of the cross-border issues. And I think these are a really welcome initiative. And the consensus statement also said the target diseases for newborn screening for hemoglobin and sickle cell disease, including all genotypes, and there should be a kind of a program and early diagnosis by newborn screening, as well as the possibility of screening when people arrive in the country is also something that is very key. So both newborn screening, pre-conception screening, but also screening of people that are come. But there also needs to be a very clear program that would address some of the challenges that people have, but also to recognize there are opportunities for the countries to actually recognize what are the research issues, what are the what are the opportunities, because we are all familiar with the fact that sickle cell disease was the first where the molecular basis of disease was actually identified, and we also know that sickle cell disease is a very unique disorder that actually could be a very key point to understand human genetics and also human intervention, particularly in terms of gene therapy. So I think this consensus statement was actually very timely. And one of the things that was lacking actually is to having a patient-led initiative that was similar to the thalassemia groups federation. We needed something that actually could address some of the specific issues that patients would encounter. I pulled this from the NASEM report, which is the engineering report by the US, and this was 2019. And this report was, the aim was to say, okay, have a long, healthy lives for those living with sickle cell disease, and in fact, included sickle cell trait as well. Some of the things that actually they addressed in their report. But their report identified some very key themes that I think are very relevant for us. And I thought maybe it would be nice to actually raise those and mention them. And I think it's something that as we're working to try and address some of the issues, we should not just work in a blank area, but actually we can work on using the key themes that they have identified. And I know that there have been a lot of efforts to establish a national system of data collection. And this has been done in different countries, but also Europe-Bloodnet, sponsored by a number of industry to try and support kind of registries. And I know in the UK, the registry has been fairly well developed in the sense that you can just check online and you can see the numbers of patients that are registered according to different centers. And also you can look at the different clinicians that are looking after them. So that kind of a registry is good that we could have something like that across Europe. And the organized system for care. And again, I can share the example of the UK because our services are delivered across networks, and we have different levels of coordination. We have the coordinating centers, which are 10 of them in England, that provide a connection for services that are specialized, services that are less specialized, so that people that are living in remote areas do not find themselves kind of left out in service provision. And also things like new therapies coming in that they also can benefit from that, or maybe bone marrow transplantation in adults that also they can benefit from that. And I think those kind of clinical networks also need to link up with the non-clinical support systems and services that are actually essential for people. And I remember listening to the French minister who actually raised some of the issues during one of the roundtable sessions at EHA. And I think there are a number of issues that are very similar, but again, there are issues that we can try and address. And I like your earlier introduction about mental health, and those things actually can easily be forgotten. And it's training the evidence base for interventions and disease management. In addition to clinical trials that are sponsored by different companies, there should be a concerted effort to actually have the platform whereby studies that can allow cross trials, because most companies would depend on their product, but actually we can look at different products that actually one can look at the combination. And I know some of these studies have been funded by the Horizon 2020, but actually there is still need for support from industry. Increase the number of qualified professionals that are dealing with sickle cell disease care. And this is one of something that actually it cuts across both Europe and the US, and also in Africa. We really need specialists that are actually interested in managing sickle cell disease. I know in the UK, pediatric cover is actually fairly good, but we still have a lot of gaps. But adult care is also fairly good, but also we have gaps. but I know in certain countries, the pediatric may be much stronger than the adult. But once patients become adults, really we cannot leave them because they need to have the care actually looking up, and then we have okay. So what can we improve? We can improve awareness, and how can we improve awareness and advocacy? I think federations like this, foundations like this, actually are something that are going to be very useful, and we can address barriers to accessing current and new therapies. What are some of the new therapies? We also know about the new therapies that are coming on board. How can people access them? Or even if they can't access them, how can they know about them? And then they can make decisions so that decisions are not made for them. And then we can implement efforts to advance understanding of the full impact of sickle cell disease and sickle cell trait on individuals and families, and establish resources that actually could support some of this care that is needed. Sickle cell disease is a global disease, and we know that particularly in the BAD, there are about 400,000 babies born with sickle cell disease across the world, and we can look after the European patients, we can look after our own country patients, but actually sickle cell disease, just like many other conditions, doesn't respect borders. And therefore, when we talk about how to address some of the health inequalities, we should remember the fact that where the majority of patients actually live and come from, our services can benefit them. So for us, one of the initiatives we're doing is to try and actually work across a number of countries, from Africa, US, and obviously, and about 10 European institutions, which we are working together with. And the current African countries that we have efforts in include Kenya, Nigeria, and Zambia. And we would like to work on some the easy thing that actually can function, particularly newborn screening, and that would also strengthen diagnosis to a extent, because some of the challenges could be even the diagnostic capacity. So how can we actually kind of support those ones? How can we work with existing advocacy groups to kind of develop really a strong network? I think we can do that by cooperation. I think the world is a very large place that actually has a lot of room for all of us together. I think really collaboration is important rather than just a competition, and actually kind of just keeping ourselves separate from other people. And I think that is why having a federation like this, it should be something that should be encouraged. I know that having a sickle cell federation like this is very key, but also I think we should remember to also collaborate with other groups, but also collaborate even with the thalassemia who have similar issues. But really, and then we aim to encourage political leaders at the highest level. We have some initiative in Nigeria and also in Zambia, whereby we work with sometimes some of the first ladies or the first men, depending on whoever is the political leader. And that is something that we have been able to achieve memorandum of understanding with Kaduna State in Nigeria, Niger State in Nigeria. And actually we are developing initiative with Ogun State, which is in the southwest of Nigeria. And also we have university-linked organizations. So I think really developing initiative that political leaders can recognize, but they should actually make sure that they're embedded within the health systems as something that is very, very key. In the UK, I remember that the establishment of the universal newborn screening started from lobbying politicians and key opinion leaders, and that is how actually it happened. And I think it should be something that we should try and continue to encourage. Really, evidence-based practices or evidence-based data is essential for you to convince policymakers. You need to understand and show them where the burden of disease is, what are the geographic population that actually need these interventions. So, for example, like in England, we have about 80% of patients with sickle cell disease actually live within Greater London. So if you're going to look at resources, you have to address those particular areas to try and say, how can we actually invest in a way that actually can develop those resources? But there is also the other aspect that requires us to make sure that people who are in a low prevalence area also have the opportunity and the privilege to have the services that are very good for them. And that is why having the network system, actually, we found it very, very helpful and very useful. And number 4 is strengthening pain management and acute care. We have actually had to develop a very specific pain management team that involves all clinicians from different parts of the country. And this is to address particularly when people have pain at home and when they come to the accident and emergencies, how do we address them so that they don't have to wait in the queue to be assessed by other patients. So we make sure that people that present with sickle cell pain receive care and are seen and assessed within 30 minutes. And I think such a target is something that is achievable. It's something that we can need to review all the time as well. And then what about stroke screening as well? So stroke screening, we have worked with Italy and worked with Ireland to kind of develop some of the centers. And I know now Raffaella Colombati is also leading an initiative across Europe to make sure that there is standard screening for stroke, particularly in children. And in adults, it's slightly a different matter. So evidence-based is something that is going to be, it's very key and it's very important. What are the next steps for coalition? I think you really cannot overemphasize the importance of coalition to assess the gaps in sickle cell care and treatment at the local and also at country levels, and offer specific resources to incentivize government to invest in sickle cell disease care on a national level. I think we do have opportunities now, particularly with the new drugs coming on board. And I know that some of the companies are very, very keen to support national programs. So I think ESCF actually, together with other organizations, need to work hard to work together to strengthen some of these functions. And then to compile a list of existing resources on the ground to leverage for scale up. So if we know that something works, how can we actually kind of take that up? And I just mentioned that aspect, particularly for Africa, some of the initiatives that are actually ongoing. Identify countries that can be used as model to catalyze efforts across the continent and demonstrate how progress can be made without tremendous cost. So for example, like the newborn screening in the UK was actually established in the back of the fact that a newborn screening was happening in other conditions. So you basically didn't need different infrastructure. You just needed to embed it in that one. And then we can create a tier system to track a country progress on healthcare investments. So I've been involved in Pen Plus. Pen Plus is a kind of initiative for the management of diabetes that was trying to make sure that care in the very in the primary care or maybe secondary care can deliver the services for patients with diabetes. And we've been working together with them to actually extend this to sickle cell disease. I know it's going to be more particularly important for Africa, but actually it's something relevant as well for European countries. So it's something that I think in Europe, I think really working together is key. Patients are also very key because you can drive the initiative and you understand the initiative and you feel the pain and you know how to address some of the issues that really can work very well for patients. So I just want to acknowledge the fact of the NASEM report, which I referred to in my discussion. And I think it's something that I would invite you to actually look at it in more details, especially as you develop the initiative. How can you work on some of the areas that they have identified? Europe-Bloodnet and other organizations, the Rare Anemias Consortia, are actually something that, I mean, they offer funding, they offer support, and they offer the expertise as well. I hope you actually know that you can access the centers, and also you have a question about your management. The Europe-Bloodnet do have a very clear resource to actually help to link us with specialists as well. So I can just say long live, and I hope that the European Sickle Cell Federation would really lead to an initiative that would address some of the challenges that we experience, but also will offer a direction forward for people living with sickle cell disease but also with clinicians involved in the management of sickle cell disease. So once again, thank you and good morning or good afternoon, depending on where you are. Thank you.